Hello, my name is Veronica Ajewale. I'm an associate professor of pharmacy practice and the director for the Community Engagement Core of the NIH-funded Center for Biomedical and Minority Health Research here at Texas Southern University. I want to say a big thank you to you and the community members for joining us for today's program. We are really excited that we will be sharing a lot of great information alongside the experts or speakers and panelists that will be leading us into this conversation. So please have your questions ready. We would have an opportunity to take your questions after today's presentations. So thank you again for joining us, and we look forward to our continued collaboration. Thank you.
Good afternoon, everyone. Good afternoon. I am Akila Adams, and it's such an honor and a privilege to have each and every one of you attend our monthly health education webinar. Today's topic, we will be going over mind over stress, tools for emotional and mental well-being. For community health workers, you will be able to receive a 1-hour unaccredited community health worker continuing education credit. The Center for Biomedical and Health Research at Texas Southern University is led under the leadership of Dr. Alloway. She is our Senior Associate Vice President of Research and Innovation. She is also one of our professors of pharmacology here on the campus. Dr. Shea is also one of our leaders. She is the professor of pharmaceutics, and she is also our program director for the PhD program in pharmaceutical sciences. Our community engagement core background consists of different topics. So one of the main things about our community engagement core is we service communities. We go to faith-based organizations. We go out into the community to serve other community-based organizations. We also service federally qualified healthcare centers. We provide different educational programs for researchers and community health workers. Each of our events, community health workers are able to receive continuing education credits. We also have community engaged research training and cultural competency training. For feedback on what we're doing in the community, we do provide surveys at each and every one of our events. We also have focus groups inside cafes. And we also host community engagement studios to gain more experience, more knowledge from the community on what we're doing, on what we can learn, and different things that are happening in the community so that we can be able to better provide educational services to everyone. This is the staff who is hired under our community engagement core. We are led by our director, Dr. Veronica Ajawale Mimwa. She is also a graduate of Texas Southern University's pharmaceutical program. Okay, for our clinical research registry, this is a clinical research registry that we go out into the community on a weekly basis. We give community members an opportunity to enroll as participants in the registry so that when we do have studies, we can contact community members to see if they would like to enroll or participate in any of our clinical trials. This program first launched in May of 2025, and since then we have over 330 people who have showed interest in signing up for our clinical research registry, and we have over 180 people who have fully consented. This study is Check, Monitor, Control. It is a healthy blood pressure study. This study is acknowledged by clinicaltrials.gov. This study is led by Dr. Poon and Dr. Tyler. It is for healthy adults ages 55 and older in the greater Houston area. We are asking those people to check who are currently taking medications for high blood pressure to check their blood pressure through an electronic device that we do provide for the study. This study is to span over 2 years. And today We will be meeting again, as I stated earlier, to discuss mind over stress, tools for emotional and mental well-being. I want to thank everyone again for joining. For everyone who is participating online, the survey is posted. If you have any questions, please enter your questions into our question and answer box. For community health workers who participate in the program in its entirety, you will receive one free continuing education hour. We are also streaming live on Facebook and YouTube in addition to Zoom. If you would like to stay connected in what we're doing in the community, please follow us on all of our Facebook pages. I'm sorry, all of our social media pages, Facebook, Instagram, Twitter, YouTube, then at CEC Southern U. I would like to introduce our speaker for today. He is Dr. John Saunders. Dr. Saunders was raised in North Texas, just outside of Dallas. Once he graduated high school, he did go to the University of Oklahoma to receive his undergraduate degree. Upon graduation, he was accepted into medical school, where he went to the University of Pittsburgh School of Medicine to complete his medical degree. He completed a general adult psychiatry residency from the University of Pittsburgh Medical Center. He then returned to Texas, where he joined Baylor College of Medicine. He currently serves as an associate professor and vice chair of community engagement. A fun fact about Dr. Saunders is when he is not working, he enjoys reading, photography, and supporting the Dallas Cowboys, Oklahoma Sooners, and Liverpool Football Club.
Thank you for that lovely introduction.
You are welcome, Dr. Saunders. And now I will allow Dr. Saunders to begin his presentation.
So I apologize. So it should be mind over stress, but the rest of the content will be kind of as advertised. And so we're going to focus on tools of emotional and mental well-being. So next slide. I have no financial disclosures to report. Next slide. A disclaimer. So the opinions and views expressed are solely my own. They do not represent Baylor College of Medicine or the Harris Health Center. This conversation can be challenging, and so it's okay if you need to acknowledge some difficulties and take a break. Next slide. So the objectives of this conversation are to briefly discuss common concerns related to mental health, and we'll really focus on some of the terminology, and then spend the bulk of the time identifying coping skills and strategies, and then talk about ways to engage with formal mental health care. So I like this slide because I think it gives us a sense for some of the terms. Sometimes people will use mental health, mental illness, mental well-being interchangeably when they have different definitions. And so mental health sometimes is simply defined as the absence of mental illness. Mental illness can be defined as aspects of a person's life that are not good, that represent a dysfunction in psychological, biological, or developmental process that affects their underlying mental functioning. And so kind of sometimes we can kind of think about that as I am not doing well in my life, and it's related to some underlying process that is related to a mental illness. And so it can be psychological, it can be biological, it can be developmental, but it has having that underlying cause in how I'm functioning. And then thinking about mental well-being, which is the focus here, and the goal is a relative state where someone's mental life is good. And so someone has positive relationships, someone is working or volunteering or doing activities that they enjoy, but really they feel like their mental life is where they'd like it to be. So next slide. So challenges to our mental well-being, stress is one of the largest. And so stress can be both positive or negative. It can have physical aspects, it can have mental aspects, but it's really this external process, something external that then causes us to respond to it. So you can think of anxiety as your body's response to stress. And again, stress can be positive or negative. So stress can be positive in the sense that it may lead us to actions that are good for us. And so I have stress about my well-being, so I'm going to go for a walk. It can also be negative. I'm so stressed out, I can't get out of bed. I can't function. I'm isolating myself. There are physiologic aspects of stress, and so the negatives ones might be headaches. It can be muscle tension, elevation in our blood pressure, loss of sleep. But really thinking about stress as this external aspect that then affects our mental well-being, both positively and negatively. And so, next slide. What are some strategies for dealing with stress? So, physical activity is a really important one. Focusing on your breathing. That's more related to mindfulness, but recognizing kind of that idea of slowing things down. Activities to proactively decrease the amount of stress that you're dealing with. Engaging in pleasant activities and limiting substance use. And we'll talk about each of these a little bit more. So next slide. Exercise. Exercise is really important when we're thinking about anxiety, when we're thinking about ways to handle stress. Exercise is beneficial for your sleep. It's beneficial if you have any other medical conditions. So obviously you want to talk to your doctor before designing a specific exercise regimen that may be more vigorous, but really kind of recognizing exercise has known benefits for cardiovascular issues, for diabetes. And then we do know that it has a benefit as it relates to mood disorders and anxiety. And so helping in those ways. The goal is 150 hours of moderate to vigorous physical activity per week. But again, you may want to touch base with your primary doctor on what is safest for you, but really prioritizing physical activity, exercise, making that a priority is something that can be very helpful when you're dealing with stress. Next slide. So sleep hygiene. This one's really important because I think one of the things that happens when we're stressed is we think we don't have enough time. And so we take that time away from ourselves. And particularly that's in sleep. And so you can imagine, well, okay, I've got to work on this topic. I've got to work on this thing. So I'm going to sleep a little bit less. But really, sleep is so important for handling stress. And so there are some things we call sleep hygiene that can be behaviorally ways that we can help improve our sleep. So developing a consistent bedtime, that can be really difficult, in particular if we have other challenges, other things that we need to do, but really trying to say, every night I'm going to go to bed at 10 p.m. because I want to get 8 hours of sleep, and this gives me the best chance. Making sure our bedroom, our dorm, wherever we are, is a dark and comfortable place if we can. So sometimes if we have shift work, making sure we have blackout curtains if we can, but giving ourselves the best chance to sleep, making sure that bedroom is a place we feel comfortable. Avoiding caffeine in the afternoons. So that can be a challenge. Sometimes we like our coffee, and so we'll have multiple cups. But if we're having trouble sleeping, recognizing caffeine can be a cause of that and trying to be proactive in limiting that. Naps are a challenge because if we're not sleeping well, hey, I'm tired, I'm going to take a nap, but sometimes that can make it hard to go to sleep the next night. And so as we can, recognizing limiting naps to try to get our sleep schedule back on track. The last two are really difficult, avoiding watching TV in bed. So what I will commonly tell people is if there is a chair next to your bed, set that chair up, but try not to watch TV in bed, that we want our body to think the bed is just for sleep. So we're not doing anything activating in bed, anything really developing habits to maintain the best possible scenario for our sleep. This includes avoiding using our phone, a tablet, a laptop in bed, really giving ourselves the best chance to get high quality sleep. And so being mindful of those things. And again, kind of giving yourself, you may say, okay, 30 minutes before bed, that's when I'm done with the phone. I'm not going to doom scroll. I'm not going to do some of those things. If I'm going to watch TV, I'm going to sit in a chair next to my bed. I'm going to watch TV, and then I'm going to go lay down and turn everything off, making sure, again, I have a consistent bedtime, that everything is dark and comfortable as well as it can be. Next slide. Social connections are huge. And so when we're thinking about how to handle stress, when we're thinking about maintaining our mental wellness, doing our best to increase and maintain those those meaningful social connections. And so it can be coworkers, it can be family members, it can be community members, but people that we know are important in our life, trying our best to maintain those connections. Because sometimes when we're stressed, we pull away. And really, those are times when we might want to lean in. We know that social connectiveness can help with both our sense of well-being, our sense of connection within our community. So why are we doing this? Why am I putting myself through this? Kind of recognizing that our deeper sense of meaning and community and connectiveness can help with that and can help with stress. And it's always important to think about how those connections, those positive relationships, can help us decrease anxiety, they can decrease depression, they can help with sleep, they can help us prevent chronic illnesses, but also having those social connections can help us manage when we do have chronic illnesses and other things that may make it really difficult as we're navigating our daily lives. And so really prioritizing and focusing on those social relationships, that connectiveness as best we can. Next slide. Decreasing stress. And so this is really being mindful and active. There are a million things that are coming at us all the time, and it can be really, really overwhelming. And so being mindful and being intentional and limiting some of our exposure to media. Now, certainly, I'm not suggesting that you live under a rock, but if you notice that, hey, when I watch this certain show, I get really, really anxious, it may be okay to take a step back from that, to avoid kind of that doom scrolling of just, okay, I'm seeing a negative thing after a negative thing after a negative thing, and I just keep going, recognizing excessive social media use. And so that may be our participation with X, it may be Instagram, it may be Facebook, all those things, but being intentional about limiting some of that social media exposure can really help decrease our stress. Uh, Engaging in activities like journaling. So writing down our thoughts, identifying our stressors, identifying what helps us feel better, but really taking time to be intentional about what we're doing to actively decrease our stress. And so journaling can be a really important outlet when we're thinking about that. Taking time and being mindful. So kind of recognizing, okay, I'm overwhelmed right now. Let me slow things down and really be in the moment. Let me focus on how I'm feeling. Let me focus on what's going on, not worrying about what happened yesterday and not worrying about what I'm going to have to do tomorrow, but really trying to stay in this moment. And we can think of that similar to elements of gratitude. So being intentional about the things that we have reasons to be grateful for. And so some people will incorporate every morning identifying 10 things that they have reasons to be grateful for and being grateful for those things. And so that's going to be unique to every person, but that can really help us stay in that moment, help us avoid some of those negative thoughts that come in. Recognizing sometimes we just need to take a break. So watching a movie, listening to music, reading a book or a magazine, sometimes when we're overwhelmed, we can think we don't have time for that, but that's a particular time when, hey, let me be intentional and let me make sure that I'm prioritizing my mental well-being by doing this thing that is important. And so kind of recognize it's okay. And sometimes we have to give ourselves permission to do that, but it can be important, particularly if we're feeling stressed. So in that idea of intentionally decreasing the stress that we're dealing with. Next slide. This one's one that sneaks up on us. So we may be someone who in the evenings we enjoy an occasional glass of wine. If we're noticing that that occasional glass of wine is creeping up to 5, 6, 7 glasses of wine, when we're noticing, hey, I'm doing some things that I don't normally do as it relates to alcohol intake, as it relates to other things, kind of being intentional that sometimes that can be signs of a larger issue. And so just being active in limiting our alcohol intake if we're starting to elevate that, trying our best to avoid tobacco products. So cigarettes, vaping, smokeless tobacco, those can be challenges. They're really difficult. There are no judgments here. But when we're thinking about ways to maintain our mental wellness, recognizing there's a relationship there to our physical wellness. And so the things that can help us be healthy include avoiding tobacco use, avoiding illicit drug use, or abuse of our prescription pills. And so if we have medications that we're taking for anxiety, for other things, and we notice, hey, I'm using this more than I should, I'm running out sooner than I should, those may be times to coordinate with the treating provider there to recognize, hey, something's going on here, but trying our best not to abuse substances in any way, and monitoring if we're noticing that. Next slide. So building on and understanding our own resiliency. And so resilience is the process and the outcome of successfully adapting to difficult or challenging life experiences. You have all demonstrated resilience. We all have. And so recognizing that can be a real source of strength. Recognizing that there is an internal resiliency that you can pull upon because you have been in difficult situations. You've had challenging life experiences and you've come through those. You've navigated them. You've figured out what you needed to do. So recognizing that that is a strength that you can rely on. And then also understanding, okay, there are mindset aspects to this. And so when I'm feeling overwhelmed with a particular stressor, let me keep things in perspective. Let me actually kind of take a step back. What is the challenge I need to address? How can I address it? Understanding that change is a part of life. Things will always change. That doesn't mean we have to be happy about the change, but it does mean that we have to accept that change is something that happens. And so understanding that, understanding what this new scenario means if we're dealing with a chronic stress or something that is new, how do we adapt to that? But understanding, okay, this has happened. There is this change. How do I address it? And that goes into being proactive. And so recognizing again, hey, I've done this before. What are the things that I need to do? So if there is this process that I need to go through, it might be identifying what the problem is, what are my resources, what are my challenges, and really developing a strategy to help utilize those resources that are available. And sometimes we don't even know them. I think a program like this is fantastic for understanding what are the supports available, what are the systems in place that can be helpful, but being proactive and trying to identify strategies to handle that particular stressor. And I recognize it can be really difficult. None of this is to say, hey, this is easy and it's quick, but it's to say that you have tools that you may not even think formally, okay, I've never really thought about resiliency, but these are things that I've done in my life that I can pull upon. And that's that idea of learning from the past. And so recognizing I've had stressors before, I've dealt with those stressors. What helped me before? Was it utilizing my social connections? And so, okay, I went to this person, they helped me brainstorm. Or was it, okay, I was exercising a little bit more then, I was watching my diet a little bit differently. It may have been I was working at a different place or I had these different things, but understanding that you can utilize the past to help you navigate those challenges that come up. So sometimes those stressors reach a point where they tip over, and now we're thinking about mental illness. And so mental illness is much more common than we think about. It's something that can be really challenging to talk about, but I think is important. And so these are just some statistics to help you think about mental illness as something that is much more common than we might think about. There are stigma, and we'll talk a little bit about that later, but there are these barriers in ways that we don't think about when we're thinking about the number of people with diabetes or high blood pressure. And so just being aware of that. And so nearly a quarter of adults had some mental illness in the last year. In 2024, 29%, or sorry, 22.9% of adults received some mental health treatment. And in 2023, suicide was the 8th leading cause of death among individuals 10 to 64. And so recognizing, hey, this may be reaching a point where I've developed a mental illness. I might need to get support in a formal setting, and recognizing in others, hey, this person's really struggling. What can we do to help? Because suicide is something that is significant. Next slide. When we're thinking about mental illness, it's multifactorial. And by that, I mean that there are lots of different causes for it. But one of the most important things to think about, and I think one of the challenges, is this idea that it is some kind of personal weakness. that, well, if I were stronger, if I were better, if I were fill in the blank, I would not be depressed. It is not a personal weakness. It is similar to physical health. And so when we're really thinking about that, I'll give an example because I think this is really important. If you or your friend were limping, some of us like to believe we were athletes back in the day. And so if we kind of went and we were limping, for most of us, we might wait a day, a week, a couple weeks at most before we would go to the doctor. And if we had a friend who was limping, it wouldn't even be that long. We might say, hey, something's wrong. You need to go and see the doctor. But we don't approach it the same way when someone is so depressed they're not getting out of bed. When we're noticing, hey, they're a lot more irritable than they normally are. They're doing these things. And so kind of understanding that those can be signs and symptoms of a mental illness, but we're not approaching it the same way, both for ourselves, but also for other people. Next slide. And a cause of that may be stigma. And so there are lots of different forms of stigma, but we'll focus on kind of that idea of public stigma. So the negative attitudes others may have about mental illness. And so you can think about terms, this person's crazy, different things like that. And those are negative terms that as a society we have associated with mental illness, to the detriment of people with mental illness. And so you can think about, well, if I want to disregard someone's opinion, I just say they're crazy. And then I don't have to listen to what they have to say. And that can have a negative impact on someone who's struggling with a mental illness, but also feeds into that larger idea. We can think about the idea that, well, someone with mental illness is dangerous, when they're much more likely to be the victims of violence than they are to be the perpetrators. And then there's self-stigma. And so self-stigma refers to the negative attitudes, shame people feel about their own illness. And so ways that are different. So someone may internalize those negative messages that they get from society about mental illness, and then they start to feel that way about themselves. And I try to bring this back to physical health because it's very different. We don't think the same way about someone who breaks their ankle, who's in a cast, than we do about someone who makes a decision, I'm struggling, I'm going to see a therapist, or I'm going to take medicines. And things like that can then build up that stigma. And it's something that we internalize as well. Well, I don't want to see someone because that means I'm weak. That means I can't do it. That means fill in the blank, when really we wouldn't approach any other illness that way. You wouldn't tell someone who broke their ankle, you need to walk it off. You don't need to see anyone about a broken ankle. You'll be okay. We would encourage them to get help. And so recognizing the role of stigma in that, I think, is really important when we're thinking about mental wellness, maintaining mental wellness, and other things that we can do. And so next slide. So when we're thinking about, okay, I've recognized this particular situation has reached a point, I'm starting to notice these things in myself that I don't like, that are affecting my relationships, they're affecting my work, they're affecting me and how I feel. Who can I get help with? And so there are lots of people who are trained to help, and you may start with your primary care doctor. And so for younger people, that might be a pediatrician. For older people, it might be their general practitioner, their family medicine doctor. But that may be the first place of entry and having that discussion with them. There are also counselors and therapists. If you don't want to start with your primary care doctor, there are lots of therapists and counselors in the community. And then there are psychiatrists like myself or psychologists. And so there are lots of different people that you can go to get help, but sometimes that idea and that thought of engaging with help can be really challenging. So this section is more to figure out, okay, what does that look like? How do I navigate that space? Next slide. So this is a common question when we're thinking about that as well, of, well, what's the difference between a therapist and a psychologist and a psychiatrist? And very broadly, a therapist is someone who is going to be able to provide therapy. They're going to be able to help with the diagnosis. They may be a licensed clinical social worker. And so they've been licensed. They may have a master's in social work. And that may be your first point of entry. It might be someone you're referred to. by a primary care doctor or even by another doctor to start with therapy. A psychologist is someone who has a PhD in psychology, and so they can help with therapy. They can also do clinical assessments, and that might be someone that you see again in that context of recognizing a mental illness is occurring and specific interventions. And then a psychiatrist is someone who's gone to medical school, who may help with therapy, but may also help with medication management. But I know sometimes those terms can be really challenging, and I don't want to spend a lot of time here, but I wanted to introduce them so that people could have a sense for, okay, broadly, what I'm thinking about a therapist, it may be I'm going to focus on specific therapy. They can be helpful for giving a diagnosis. A psychologist may be more in-depth as far as the testing and the therapy. And then a psychiatrist may be someone they're seeing in a more classical medical setting, who's helping with medications, but who can also provide therapy. Next slide. So what to expect that first appointment, because this can be really, really scary. So kind of the example you may have of someone who looks like Sigmund Freud, who's wearing a coat with patches on the elbows, who's going to have you lay down on a couch is probably not what your experience is going to be. It may be that you're sitting in an office, and they've got a computer and they're asking you a lot of questions. But it's really important that you feel empowered so you can let them know what you want to address. And they may ask you that. That might be one of the first questions is, what are your goals? What do you want? But that first appointment can be overwhelming because they're going to ask you a lot of questions. There's probably going to be a computer, and I know people don't love that. And so those are some of the things to just be aware of in that first appointment. But it's okay to kind of start that process if it's something that you need. But just kind of recognizing it. And we'll talk a little bit more about some of the questions that they may ask, because I know there are real concerns with, hey, what is this person going to ask? Who's going to have access to this information? Next slide. So some common questions might be, how long have you been feeling this way? Do you notice any things that make you feel better or worse? And so, yeah, when I interact with this person, I feel much worse or I feel much better. Or when I get a good night's sleep, I feel a lot better. But it gives you a chance to really think about that, because sometimes we don't. We're so busy, we're going through life, and we don't really have a chance to sit down and think, well, okay, what do I notice when I'm feeling bad? Important safety questions are going to be if you're thinking about hurting yourself, if you've hurt yourself before, because that helps them figure out from a safety standpoint what they might do. As far as, hey, what do we need to do to make sure you're okay? Obviously, they're going to ask you if you're thinking about hurting other people, and these are general questions. They're not specific to you. They're not asking you this because of anything unique to you, but they do want to understand you in the context of those questions. They may ask you about how much you smoke or how much you drink or if you use any drugs. And again, that helps them understand what you're going through. But those can be questions that sometimes feel a little bit intrusive. And so it's okay for you to express that. They're going to ask you about your medical history, your family history, and it may be information that you don't have. But those are going to be some of the questions. And then if you've ever been in treatment before, and in that context, if there were things that were helpful for you. But I like this slide because sometimes people don't know what to expect when they're seeing someone professionally as it relates to mental health. And so just giving them a broader outline of, okay, here's some of the things that I can expect in that context can be helpful for removing that stigma, the same way that if you went to see your primary care doctor because you had a cough, they're going to ask you similar things. How long have you had the cough? Do you have a fever? Do we need to get a chest x-ray? Are there things that help when you're feeling this way? And so just thinking about kind of that mental health assessment in those professional settings in a similar way that we would think about any other doctor's appointment. So next slide. So your information is protected. So HIPAA is a law that specifically establishes the protection of your protected health information. And so that can be things like your name, your address, your phone number. There are certain entities that have access, so your healthcare provider, health insurance, things like that. But this is not information that is going to be on a job application. This is not something that, unless you choose to volunteer that information, that this is going to be distributed, that this is your protected information and it's going to be treated as such. There are some exceptions, and so these are required by law. So if there's a known victim of abuse or neglect, law enforcement, judicial proceedings, sometimes those can kind of supersede HIPAA, but you can generally think about this as this is a shield protecting this information so that you feel comfortable. And there is inherent confidentiality in any of these relationships you have with a professional when you're going in to describe, to talk about, to receive treatment. So next slide. So one of the biggest questions people have are, well, if I go see this person, they're just going to send me to the hospital. And there are specific scenarios where someone may feel like, hey, there's a safety concern here, and this person might benefit from being in a higher level of care, but generally that is not what's going to happen. If you are doing things or saying things where there's a concern that you might be a danger to yourself, and so if you're having frequent thoughts about killing yourself with the plan, and these are the means that you have, then those are real times when a hospital can be a safe place. So active suicidal thoughts or plans or intent. If you're deemed to be a danger to other people, and what that might mean is, yeah, I've had this specific thought about killing this person or hurting this person. Those are also times it's much better for you to go to a hospital, get treatment, than potentially do something that you can't take back. But these, again, are very rare in times when, hey, this is a higher level of care. The same way that if you went to see your primary doctor and they thought you were having a heart attack, you wouldn't want them to just keep you in the office and kind of just say, okay, you're having a heart attack. We're just going to talk about it. No, you'd say, hey, this is going to require a higher level of care. And so sometimes there are scenarios where people will get recommended to go to the hospital, but is not what the doctor is looking to do when you first come in, that they want to get a full assessment of how you're doing. And then if there's kind of an inability to care for yourself. So that's not something we'll typically see by themselves, but you may have someone that you notice, well, they're not eating, they're not taking care of themselves. And then that might be a scenario where someone may recommend they go to a hospital. And so you can think about that as, if you're not eating after a certain period, then there's a physical health issue that's going to develop. If you're not drinking, and that may require it, and sometimes it can be related to a mental health issue. And so someone can be so paranoid that people are putting things in their food that they may not eat or drink for days. And that's a scenario where, again, they might benefit from being in a hospital where we can make sure they're safe. But it is not common, and I know that's a big, big concern when someone even thinks about engaging in formal treatment is, am I gonna be hospitalized? What's gonna happen? And that's not the common scenario. So next slide. So this is really important. You want that interaction to be collaborative. You want them to focus on your recovery, whatever that is, whatever that looks like for you. You need to be comfortable because this is information. They're going to ask information that's personal. And so feeling comfortable in that scenario is really important. So taking the time to make sure that that's a good fit. And if it's not, it's okay to see if you need to see somebody else. It's always okay for you to ask questions. And so if you're ever made to feel like you can't ask questions, then that's a concern. And so it needs to be a respectful, collegial attitude to help you get where you want to be. And so knowing that you can ask questions. You do have options, but I also recognize it's hard to get in to see providers. And so but you don't have to feel like you're locked into seeing the same person forever if you don't feel respected, if you don't feel that you're getting your needs met. And so just knowing that you have the option to look at other places. But it's a place where you need to feel respected for you to be able to do the work with your therapist or your psychologist or your psychiatrist or your primary doctor needed to make sure your health needs are addressed. Next slide. So crisis information that's out there. And so the Harris Center and the number is there. They have a mobile crisis team. They have the Neuropsychiatric Center, which is next to Ben Taub, the hospital. There's the National Suicide Hotline Prevention and the addition of 988. 911 is always an option. The National Hope Hotline, the Veteran Crisis Hotline. You can present to any hospital, or again, if you know someone who's in a crisis, they can present to any hospital. Here are just some hospitals I listed, but really they can go to any hospital, and the hospital will assess them and determine if they are stable. But if someone is in a crisis, any hospital is okay and a place that they can go to make sure that they're okay. But these are just some crisis services that are available. Sometimes that can be a question of, okay, well, what do I do if there's a crisis, or what do I do if I have a loved one or a friend or a family member who's struggling? And so these are crisis services that are available. And next slide. Okay, so in summary, kind of mental well-being is defined as a state where our mental life is good. We recognize that there are challenges to that. It is different than the state of having a mental illness, and it's different than also just the idea of mental health, but really an active state where our mental life is good, but there are stressors that are part of life, and developing coping skills, recognizing when to use those coping skills, what those coping skills look like, can help prevent us from being overwhelmed at times. But there are times when we might benefit from seeking help, understanding the role of stigma and preventing us from that, and being okay with utilizing the resources and treatments that are available. And so that's the summary slide. I know I went through things pretty quick, but that does give us some time to go to questions. I think that's the last, oh, sorry, the next slide is the reference slide. So here are some of the references that I used. And thank you all for your attention. I'm excited to continue the discussion, but I hope this was a helpful primer as we're thinking about coping skills and ways that we can recognize how we can maintain our own mental well-being, and then resources either for ourselves or others when we're starting to feel like we're moving into an area where we might need or benefit from some additional help.
Good afternoon, everybody, and thank you, Dr. Saunders, for sharing that information and your knowledge and expertise, especially in our topic for this month, which is, again, mind over stress tools and emotional mental well-being. So we sincerely appreciate, the valuable education and the practical tools and the increased awareness that you provided with us today. And just before we get started, we do have a few questions. We have one. So it is, how helpful is the EAP for mental health or mental illness?
Sure. So it depends. I believe this is an employee based intervention. And so each, I guess, job is going to handle it a little bit differently, but typically it's a great place to start. They'll usually have some services available that they can offer for free. So I don't know the specific number, and I think it depends on the specific EAP and the specific employer, but somewhere between 2 and maybe 6 therapy sessions that can be offered for free. And so it's a really good place to start. And then they may have referrals if that person needs some additional or continuing support. But I think it's a really good place to start, particularly if you have an employer that offers an EAP.
Thank you for that. We do have another question. They're saying, thank you for all the information that you provided today and that it shows a whole list. The only relevant one is the evaluation, which can be done after the session. Please advise.
Sure. Is
So
that for me or is that for you as far as the list? in the
Oh,
evaluation.
goodness. Oh, I'm sorry.
No, I
Disregard that.
apologize.
Sorry. All right. Let me see if there's any more questions for you. All right. We do have one more. Any tips on encouraging caregivers in participating in mental health sessions?
Yeah, I think caregivers can be great sources of support for both for the person that they're providing caregivers for, but also information. And so you may talk to them about they're going to see things in their loved one that their loved one may not see in themselves. And so you can kind of help them recognize the role that they have because they're seeing a side of this person that that person may not notice. And so that's information that can be helpful when they're going to a mental health session. And so that's how I would approach it is you have this really helpful perspective that can be missed by the person because the person is they're living their life one way and seeing things and they may not notice, oh yeah, you're not sleeping as well and you have been losing some weight and I've noticed you've been a little bit more irritable. Those are things that it's harder to see from the inside than if we have a caregiver on the outside who notices those changes, and that can be information that's really invaluable if this person is engaging in mental health treatment. And so that's one of the ways that I would approach it, as, hey, you have this really unique perspective that can be helpful for your loved one to get better. I also recognize time is difficult. And as a caregiver, there's already inherent stressors. So you're providing care and support. You may not be able to miss an appointment. You may not be able, miss time from work to make an appointment to go to those things. So sometimes if they want to just write down what they're observing, that's information that their loved one can give to the mental health specialist. And that's a way that they can pass along that information if they're not able to physically be there. Um, and within HIPAA, sometimes there are some challenges that can make it difficult for caregivers. And I recognize that where they have gone to an appointment, they know this person's in treatment, they call, and the clinician may say, hey, I can't release that information because this is protected. And usually places will have a release of information that can be really helpful where then the clinician has the patient's permission and it's a written document that allows them to do that. But we take HIPAA very seriously, but I know it can be a frustration for caregivers when they're trying to call and get information about their loved one coming from a place of caring, and then kind of getting that feedback that, hey, this person is not going to tell me what I think I need to know without this additional release of information or permission from a loved one. And I know that can be frustrating.
Yeah, thank you for that. And I know with, life, we have a lot of responsibilities, and we can probably take one or two more questions. We have one. So what is being done by the mental health community to help with the current increase in suicide among young college professional athletes? Another one committed suicide from Sam Houston this past weekend. So do you have any advice and awareness and education regarding that question?
So that's a great question. I
Mhm.
don't know of any larger systemic changes that are being made outside of increasing access and decreasing barriers to engagement. But as far as specific interventions that are being done at the collegiate athlete level, I couldn't speak to that. That may be something the NCAA may have. But I would say discussions where we're empowering people to utilize services that typically there may be stressors that are leading up to that. And so having someone recognize, okay, I need to engage before it's reaching the point where they feel like they have no other options except in their own life. And so that may be things that we do as far as public informational sessions like this. It may be more active engagement at the level of young adults. And so, what are things we can be doing on campus? I think those are probably the interventions. And then within athletics, it might be specifically engaging with athletic directors, coaches to see, okay, what are the interventions that they have available? But I know that's probably not a satisfactory answer to that. And I'm very sorry to hear about what happened at Sam Houston. And so, I would say, starting here and really increasing this awareness the same way that there's a statement for stroke. What to look out for if you have someone kind of recognizing if you see someone who's in trouble, being empowered to, again, very coming from a place of caring, but just say, hey, I notice you're not doing as well. And that can be really difficult because we can see people struggling, and that may be a place that we all feel more empowered to engage.
Yes, thank you, Dr. Saunders, for that information. We do have quite a few more questions, but with time, we're going to go ahead and we'll answer these questions, and we can get these answers answered in our next upcoming newsletter. So thank you again, Dr. Saunders, and for providing and donating your time and providing all the educational information and awareness regarding mental well-being and the tools. So thank you again.
No, thank you for having me. This is a great initiative. I'm really,
Yes.
hopefully this is helpful, and thank you again.
Thank you. All right. So as we see, previous slide, please. Thank you. Just friendly reminders for community health workers, please post your questions and answers in the box. And also the survey link has also been posted in the chat. You are receiving 1 hour community health worker CEUs, and you must complete the survey and evaluation to complete the credit. So there is the QR code. Again, we are streaming live on Facebook and on YouTube, so we invite you to share along with all our other social media platforms. Again, staying connected by subscribing to our mailing list. And so you can either text or click the QR code. So thank you again. Next slide, please. And here's a calendar of our community outreach and engagement events. So you can see here, it's from June 26 all the way through May 2027. Again, so as you see here, we have some different topics. Our most recent one that's coming up is Alzheimer's, dementia, and healthy aging, and our back to school event. So please stay connected. There is a QR code for our link tree. Next slide, please. And again, as I mentioned, we do have our upcoming event, which is Caring for the Aging Adults, focus on healthy aging and Alzheimer's awareness, which is occurring June 17th. So please join us, register. This is a QR code. You can, it is also a webinar event from 12 to 1. So hope to see you all there. Next slide, please. And again, as Akila had mentioned earlier, this is our check, monitor, control blood pressure study. It is led, as she mentioned, is led by Dr. Poon and Dr. Tyler, which focuses on American adults after adults age 55 and older. And it's helped to better manage and control their blood pressures. So if you are interested, please click on the QR code and you can get additional information on there as well. Next slide, please. And just a friendly reminder again regarding our clinical trials registry. Again, it launched back in May of 2025. Up to this point, we have over 330 interested clinical research participants and over 180 fully consented. With this clinical registry, it's providing education and awareness regarding clinical trials and connecting the community with those resources as well. Next slide, please. And a friendly reminder, this is again our TSU Mobile Health Unit. We are wanting, if you know of anybody or if you and your organization are wanting to get connected and maybe partner up with some future partnerships, please reach out to us where everything is good and ready to go. So again, if you're interested, please reach out to us and we can see about connecting with your organization and upper leadership and how we can get started. So thank you. Next slide, please. And again, a friendly reminder for community health workers, free 1 hour community health CEUs. So again, just make sure to complete the survey and evaluation to receive a credit. There is a QR code and the links have been shared in the chat. So let me share it one more time. And again, for all online attendees, any questions and answers that were not answered, we will be able to, you can see those in our upcoming newsletter. And please stay connected. We are streaming live on Facebook and YouTube, so we invite you to share amongst your community partners and amongst your organizations. So again, staying connected with us on social media. This is the QR code and links have been provided. Which is for the community health worker CEU survey and also for the clinical registry. If you are interested, please go ahead and click the link and share amongst your partners and organizations. So thank you all for today. It is a pleasure, and thank you all for joining. It was a pleasure, again, Dr. Saunders, to having you here, and for all that wonderful resources and education you provided. Thank you so much.
Hello again. My name is Veronica Ajewale. I want to say a big thank you to each and every one of you for joining us for today's program. I am very certain that you have received a lot of great information that you will put to practice as we all grow together to become a healthier community. Thank you to our speaker and our panelists. Thank you for sharing today's content with us. Thank you to our locations. Thank you to our interns, our volunteers, to our sponsors and our funders. Thank you also to the staff of our program, the faculty, and the leadership of Texas Southern University for supporting us in making today's program a success. Most importantly, I want to say thank you to each and every of you, the community members. We appreciate your support. We do not want today's program to end just with today's event. We want you to continue to collaborate with us and engage with us. Our social media platforms are located at CECTX Southern U. On those platforms, you will find engaging information from today's program and all the other programs that we have going on in the Community Engagement Corps. So we implore you to continue to stay connected with us, engage with us as we move forward together in building a healthy and a wealthy community. Thank you for joining us, and we look forward to connecting soon. Bye.